Next on our agenda is the panel that is going to focus on data for health. Okay? And as we are aware, most of us, not most of us, but all of us that are in the space of health, we know that in order to achieve as a country, we must invest in high impact practices that reap high health outcomes. And we cannot achieve unless we invest in data for health. So we are building on to the conversation that just ended. We are continuing to discuss data for health, and in another angle, the panelists are going to focus on civil registration of vital statistics with a focus on the Ugandan landscape. So very quickly, allow me to invite the panelists. In the room, we have our colleagues from NERA, but for the panel, I'm going to invite our technical expert in this area. We have Dr. Robert Stephen Kasumba. He's part of the National Identification and Registration Authority team, manning the technical M&E arm at NERA. We welcome you and thank you for joining us. I request you to come and take your seat. And as Dr. Robert Stephen is coming, we must all be aware by now that there are different MDAs that are behind vital statistics. NERA in particular has interest in ensuring that there is notification, there is registration, but there is also certification of key vital events in the country. And the others that are in play, we have URSB, then we also have UBOS that is registering or coordinating overall vital statistics. So in the room, as we speak right now, Dr. Robert is going to focus on civil registration of vital statistics with a focus of the NERA arm. The next on the panel, we have Mr. Talibita Moses, an advocate, a lawyer, very passionate about the rights of citizens. If you know Moses, he's the face of the Patients Charter. By show of hands, who has heard of the Patients Charter? The National Patients Charter. Okay, so the face of the Patients Charter has been Moses, and he's been championing the rights of the citizens of Uganda. I welcome you to take your seat. Please, you're welcome. And colleagues, my panel today has gender imbalances, but bear with me. The next on the panel, we have Mr. Robert Ofiti. Robert Ofiti is a regional coordinator for HEPS Uganda, and he coordinates mainly the northern region. As a manager, he's been also implementing data for health models in the region. Let's welcome him to tell and share the story of what HEPS is doing. Robert, you're welcome. And finally, on our panel, we have Mr. Kenneth Mwehonge. Kenneth is the Executive Director of HEPS Uganda, and he's the face of HIV programming in Uganda, I should say. He has a length of information and knowledge when it comes to data for health. So this is the panel that we have before us, and we shall straight away go into the first question that we are going to start off with the overall understanding what is CRVS. What is CRVS and how do we stand as a country? We are going to have Mr. Moses Talibita walk us through the introductory session of what civil registration and vital statistics stand for when we talk about health equity realization, especially at a country level. I welcome you, and please, if you may. Thank you.
The pleasure is all mine. Allow me greet you, because this is the very first of its kind I'm speaking, and I also want to thank the organizers of this meeting, or rather this conference, two-day conference. I cannot thank you enough for also giving me an opportunity like this to also have my say. I agree, I am a civil society participant. And yes, I have mobilized citizens to embrace, for instance, the Tobacco Control Act. But also, as she did say, I am a patients' rights campaigner. I tell doctors who detain patients to release them because two wrongs don't make one right. And of course, also, I cannot go without saying that we have the Patients' Rights and Responsibilities Bill, which has delayed and government has not, but this very year, one of our fellow civil society members took government to court, and the Minister for Health, and then court declared that indeed patients shouldn't be detained because that is illegal, and that government should come clean and on pricing and also regulate it. But the most important thing is that the Attorney General's office was requested within 2 years to update court on how far they have gone. So I know for a fact everybody here who is in civil society keeps saying we want to have place at the table of where decisions are made. Not so. And we have our constitution indeed says they are civic rights. So which means we want to participate in all government business. And indeed we are allowed to participate in the lawmaking process. We are also allowed to participate in the policy making processes, all of them, and also the budget making processes. So I am going to speak to a whole of government approach that civil registration, the vital statistics, benefit all ministries, departments, and agencies of government, and every one of them benefits from the data that is being generated. And the other is a whole of community or society approach, that we the citizenry who benefit the most in the data so generated and also certified and given particular documents, we also need to increase uptake of these particular services. I think everyone, us who came here, you started at the registration desk. When a child is born, you want them to get a name. Either you take them to church or you take them to your other fellow or faith-based or other traditional or cultural institutions, that they can have a name, and that name will distinguish them from the others. If say they have both, rather if they have both names that perhaps are for the grandfather, then you want to call them senior or junior or whichever name. So I want to limit myself to the theme, and I want to coin a topic, the role of the health sector in strengthening civil registration for vital statistics. Allow me to take you through the definitions. I will only define two phrases. The first is civil registration, and the second is going to be vital statistics. Civil registration is the continuous, permanent, compulsory, and universal recording of occurrence and characteristics of vital events pertaining to the population as provided through a law. So I hope every one of us knows that if your child is going to go to school, they need to have a NIN, a national identification number. I'll give the example. If say they get born in the health facility, they are given a birth notification number, right? That form you pick, many people think that that's a birth certificate, that they have completed registering their children. No, that is just to notify a government authority that is accredited and is required by a statutory body or regulation that they give the actual certification. That said, allow me also try in a way or the other to define vital statistics. They are vital because they are significant, they are important, they register vital events in life. So Vital statistics constitute the collection of statistics on vital events in the lifetime of a person, as well as relevant characteristics of the events themselves and of the person and persons concerned. Vital statistics provide crucial information on the population in a country. I'll give the example during COVID. You remember we were looking for people who are vulnerable, and we could not with certainty know where they are concentrated, or who they are. But we have a Ministry of Gender and Social Development, for that matter, who are required to perhaps have a registry of the vulnerable people. Who are those that benefited when government was giving food aid? You remember there were those who perhaps their jobs had been closed and could never get work. Because of the vital statistics, the surveillance, the data that is collected on a daily basis, now we can come and have a meeting like this. We are not even social distancing, are we? And COVID and all those pandemics rely on that data. And that's why that information, so being collected, is very key for making decisions. Is it a problem that people are not registered or they are not documented? Truth. Such is a problem. Globally, according to the World Health Organization, globally 2/3, which is about 38 million or 56 million annual deaths are still not registered. If I also pose the question here, how many of you have succeeded to get a death certificate? It is tedious. John did say you need to come to the Uganda Registration Services Bureau, the register for death, so that you get that document. And if you don't have a lawyer near you, it will be so costly, and that of course has led to a lot of disputes in homes. So if you are not going to get benefits of the deceased through the Succession Act, most of the citizens have just ignored it. Do hospitals give death certificates? I am asking rhetorical questions. So there, of course, I'm also speaking to many barriers. Yes, very few deaths are registered, but also many children go unregistered. Almost half of the world's children are unregistered. Of course, I have hinted on the barriers, their cost, their distance, and of course also, I must also bring to your attention that there are districts in Uganda that do not have a NIRA office. So when death goes uncounted and causes of death are not documented, governments cannot design effective public health policies or measure their impact. Somebody was talking about non-communicable diseases. Annually, we are having reports on prevalence. So if you do not know how many people you are afraid, the moment you start to write the will, you think you're going to die the next day. But it's important to know where you leave your people. Let us live with certainty. So the reason as to why we don't document, we don't complete these cycles, either there is no incentive, until when government says you cannot open up a bank account, you cannot study, that's when you have to go through the long, winding cues. Civil registration and vital statistics, like I have said already, records birth, death, and other major life events are essential. For instance, how many Ugandans are married and are in legitimate marriages, or that their marriages were constituted by people authorized to conduct marriages, until when property becomes an issue, that's when people look at their document. Or how many have registered their African traditional marriages, or it just ends at gifts. So CRVS is critical in protecting the fundamental rights and freedoms of individuals, and in particular women, girls, and other vulnerable children. Imagine if children do not get registered to completion. Believe you me, they'll be conscripted into the army as child soldiers, or they'll be subjected to child labor, or they will be exported abroad, or they will fail to get a travel document. So, a well-functioning civil registration vital statistics system registers all birth. You remember I talked about a whole of government approach, a whole of society approach, which talks about universality. So any child who is registered, rather who is born, is entitled, because they should enjoy a right to parentage. So if they have not been registered at that point in time, who will be their father? In the Ugandan context, who will be there? To which clan will they belong? If, say, they are going to get married, they'll have issues. And if it wasn't checked, they'll commit incest. So registration is also a call of why are we bringing such a topic at this point in time? Because the Sustainable Development Goals have already set up a target by 2020, rather by 2030, at least a certain percentage of people ought to be registered. But at least all the 5 years, the 5-year-olds, by 2030, at least all of them should be having a birth certificate. This, of course, speaks to the institutional framework, because if there is a service like civil registration with the vital statistics, isn't there need for an institutional framework, a policy framework, and a legal framework, which, by the way, is well financed? Because without sufficient budget allocation, all these services will be delayed, as is evident in all corners of Uganda. So this particular, I am afraid what is being shown is different from what I'm presenting. But the institutional framework, the Registration of Persons Act charges a responsibility with the NIRA. And I think I am not competent enough to talk about the NIRA issues, because Mr. Kasumba is in the house. So I'll leave that to him. But also I want to, as I conclude on this particular slide, is that the health sector is very central, because they deal with the citizens as they start life, and that they must register live birth and even those that are not alive. And I hope at some point we were engaged in advocacy on saying no mother should die when they are giving life. Those maternal death reviews are also an incentive on checking the system, on whether there is somebody who is sleeping on job, or somebody is being overburdened through the very low human resources in the health sector. I hope we are also aware that the Ministry of Health deals with the health sector. But there is also the Ministry of Internal Affairs, which deals with, which is the political arm where NIRA belongs. But there is also the Ministry of Justice and Constitutional Affairs, where Uganda Registration Services Bureau is resident. But I'm told now they are going to get their home in NIRA. But the Ministry of Justice and Constitutional Affairs is the one that is dealing with registration of marriages, or even when people have disputes, they are going to divorce. They will go through the court process, and of course also the registers, the right to privacy. This information that is being given should be given to an institution that is competent at not just letting every other body know. I hope you're aware that at some point when Uganda Revenue Authority requested of banks to give our private data, all of us were up in arms. Why? You know best. So the other is there are also those that benefit from data which is being generated. And institutions of government that so benefit, Uganda Electoral Commission, when we are saying all politicians must ensure that we are all registered as citizens, that they must advocate that there is sufficient funding. They must advocate that there are enough staff for NIRA in the regional offices, and that the NIRA services should be extended to the last end mile, and accessing them should be cheap. And there must be more incentives for people to walk without being compelled to the NIRA offices. And I also want to throw a jibe, because civil society would want to, especially when we meet government, we also want to tell them that they should have a client's charter, where you ensure that as the clients come and seek these services, let them really not get frustrated at the end of the day. I hope you are aware that going through the process of getting a passport is so tedious. But you have had the public relations officer for
Moses, as you conclude.
Yes, this is the very last. You hear that there are many passports, they are complete, and people are not picking them. And so is with the national IDs. Allow me end here, and I yield my time to my other colleagues. Thank you.
Okay. Thank you, Moses.
Thank you, Madam Facilitator.
Oh.
Let me speak from here. Colleagues, my name is Stephen Robert Kasumba. I am the manager, monitoring and evaluation in the National Identification and Registration Authority. I have not prepared anything, but just as a way of background, I was also a commissioner in the Cabinet Secretariat for some time. This one deals with the policy formulation. What I wanted to bring to your notice is that now we are looking at civil registration and vital statistics in this country. As Moses has said, if I'm to start, you are aware of those vital events in our lives. We are aware that we are all born at one time, then we marry or go into divorces, then we die. That circle. Then again, we produce children. Maybe other way of asking I wanted to know whether you have dealt with NIRA before or not. I know all of you must be having a NIN. At least that one I know. Other way of introducing again, I think it is important that I talk about the mandate of NIRA, just briefly, because I know this is something you may be interested in knowing. And I was wondering, I was seeing some wonderful researchers here, doctors, professors, and when I looked at the theme of today, it's like advancing health equity.
Just to interrupt you a bit.
Yes.
Sorry about that. As you give the overall mandate of NIRA, the other interest was to know the current policy and legal landscape for registration of vital statistics, but also to know what is in the pipeline, because there are a number of activities ongoing, mass registration, the sensors. How is NIRA leveraging on such platforms to ensure that there is registration of vital statistics? And how do you want the people in the room, the stakeholders here, to be on board with NIRA as we push for the national agenda around registration of vital statistics. Thank you.
Exactly. Thank you so much, moderator. Maybe just to briefly talk about our mandate is derived from Section 5, subsection 1 of the Registration of Persons Act of 2015. As I'm speaking now, it is undergoing review. You are aware in Parliament. My colleagues are in Parliament and advocating for our case. But we are responsible for creating and managing and operating a national identification register. This one I will be referring it so many times. Of course, we also register citizens and non-citizens. We register birth and death in this country. And very soon, as you have heard about the mergers of some of these enterprises, we are also bringing that function of marriage and divorce to NIRA. Of course, we also issue and promote the use of the National Identification Register. This is the foundation register, which has all your database. All the other institutions in this country are actually verifying their data with the use of our National Identification Register. So what is happening, or what has been happening, is to ensure that those vital events are registered. I could see, for us as a NIRA, we cannot operate without the Minister of Health, without the Minister of Local Government, and without the Uganda Bureau of Statistics. Those are very, very vital entities in this country if we are to operate effectively. I have seen a number of researches are coming up, but that operational part of it, ensuring that you influence the policy change, I think there is a gap. There's a very serious gap on that. What is happening at the moment is we are developing policy. We are actually coming up with a CRVS policy, which has to be fed into those wonderful researches. Majority of you may not be aware that that National Identification Register take into account some of the vital events in our lives, even the prevalence of certain diseases, because you cannot register death without actually coming up and picking up the underlying cause of the death and maybe the immediate cause of death. That one is very important. You may be aware that NIRA has been involved with the Ministry of Health to train a number of health workers in that area, which, because of time, I may not go into details. But as far as the School of Public Health is concerned, I think you had two wonderful researches you have done on NIRA, which I think can provide a basis as we develop our CRVS policy. Recently, you had a number, you investigated our database. You came up with a wonderful product, the CRVS, the analytic on the CRVS data using our data identification register, which was so wonderful. And previously, you also came up with a operational research on identifying those areas where we have missing gaps. What is not doing well? Then when you go to COBAMS, again of Makerere University, they also carried out a wonderful research on the barriers of death registration in Uganda, which is also providing us with a wonderful input in our CRVS policy. So I could confidently say that we need you. Please look at the CRVS policy. You look at the issues of birth and death registration in Uganda. Over 64% of death actually happens in the community. Our colleague, I was excited when she was really presenting you call them what? Those ones in the field, down there, the extension workers. There was that time which used to come, the community health extension workers, but I think the government abolished it, I don't know why. But they are now called VHTs, voluntary health what? Health teams, VHTs. We want to see how we can make use of them actually, at the grassroots. We have tested. The problem with us as NIRA, of course, we are dealing with every Ugandan, every individual Ugandan. And we are dealing with all our babies, we are dealing with everybody. But at one time we had carried out a test in our Juman district, of course, on death registration. And it yielded some good results if we were to use VHTs. And we are promoting it in the new policy. How can we use the VHTs to ensure that we really register all this death which happens in communities? As I told you earlier, National Identification Register cannot work in isolation without the Ministry of Health, because they provide us with notification. These are some of the detailed business process maps, which I don't want to go into, We are also, none of these organizations, the banks, the NSSF, the private sector, Makerere, you know those of you now with your needs. We are promoting, we make use of the National Identification Register. And we are saying that the Ministry of Health should ensure that there is no duplication of efforts at any one time. We have managed to save a lot of resources. So what I can advise you researchers, because whenever I go to Parliament, we are asked, what is the cost of registering an event? And how can we ensure that the resources are provided? These are some of the areas I think which have a lot of gaps, which we think our good researchers can venture into. And we welcome the people who are interested in CRVS research so that they can come and join us and its implications. Thank you so much.
Thank you very much. I'm sure a couple of questions will follow through. Allow me to invite, now that we have the preamble, allow me to invite Mr. Kenneth Mwehonge to explain to us why do we need strong CRVS systems in Uganda? So just that justification and rationale as a country, why do we need strong systems? Kenneth, I invite you.
Good afternoon, everyone. I'm Kenneth Mwehonge, the team lead at HEPS Uganda. And I know our sugar levels are low, but just bear with us. Just to bring this into context, I know we're talking about health equity here and wondering why about data registration, vital statistics. It's very, very simple. We all need data for planning. And the statistics given by my colleagues, half of the babies in this world go unregistered, are not registered. And that's a statistic from the WHO. And that's concerning because if you don't know the number of people that are being born, you don't know why they are dying, you don't know where they are dying from, you don't know where they are being born from, then it's very difficult to plan for them. And also surveillance and knowing why people are dying, of what diseases. You also cannot design interventions that are tailored to addressing what is causing this death and then having appropriate public health interventions to stop them. In basic terms, that's the overall purpose of why we need this data for health. But currently, the landscape is not so good. You've had our colleague from NIRA. They register, all of us here, I presume he asked how many of us have a NIN. We all have NINs or national identification numbers. But his system doesn't speak to our health systems. Many of us were born in facilities. However, we never proceed to register with NIRA. And the point here we're trying to make and having a comprehensive CVRS system is having systems that speak to each other. If there is a birth notification in a health facility, they should be able to get it as the authority that is in charge of registration of Ugandans and systems that are speaking to each other. But currently, that's not the case. And even when we go to the facility, someone feels out, it's a NIRA role to register. I have my other role to play to ensure that the child is born well and is alive and the mother is alive, and that's it. And having them, that child registered, it's sort of an additional role. And why we brought this here is, as players in the health sector, is to support the different government agencies to speak to each other. Propose ideas on how best we can have harmonized systems that we track this once and for all. We don't have to, maybe if I'm born in a facility, then I have to move to another place to do this registration. But we want a system that is more comprehensive. But also, as you've had for NIRA registration, we don't have like full coverage in terms of places where this registration is being done. And we want a full coverage. And that's much cheaper. You'll, in the coming months, going to see NIRA doing mass registrations. But if we had a system where it's routinely done, we wouldn't need doing such mass and heavy investments on one-off registrations. And those are the systems that I would want. So our plea to you is that there are several issues within our civil registration of vital statistics, both legal, the policy, some of the lead government agencies that are responsible for this, also structure-wise not speaking to each other, and that's what, as civil society, we want all those dots joined so that we have real-time data, health disaggregated data for planning. We've seen where we run, for example, to facilities and the medicines are not enough. The challenges are with these quantifications, but you can't quantify for a population that you don't know. You don't know how many are being born. You don't know where they are being born. So issues of equity come in here. If you don't have data, then we can't talk of equity. And I love what Professor Roda said yesterday. We talk a lot about these public health interventions, but little is being done. And this is one of them. Not having appropriate data and correct data, updated data, and that's what we are pushing for. I think in a nutshell, it's quite a lot, and we'll have subsequent engagements on this, but that's what I wanted to share with you. Thank you.
Colleagues, thank you, Kenneth. Finally, we have Mr. Robert Ofiti, who is going to walk us through what is in the pipeline. We know that with NERA and with vital statistics, not many civil society in the mainstream area have been in this space. What are some of the platforms that we have as civil society to work with NERA and the other MDAs to ensure that we have strengthened systems at country level? I welcome you, Robert. Over to you.
Thank you, Joan. I pray to present from here. Good afternoon, our distinguished delegates. Once again, I'm Robert Ofiti, and I'm glad to be part of this conference. What Joan brings as a question is something that my colleagues have already hinted about, but now in the perspective of CSOs, one of the issues that we have discovered with working with MDAs is that information flow sometimes does not reach the targeted beneficiaries. And this case with CRVS, it is a new, it sounds like new, but yet we've been having it. It is a human right. When someone is born, they immediately, within 48 hours, should start benefiting from CRVS services. But because we've grown from a background where it is not urgent, not known, or misinformed about, it has gone and it's part of our culture. We don't care. Yet it should be in the system, that the system causes you register a birth, get a NIN, get an ID after 16 years of age. When children are born, you do the same. Marriages are registered, deaths are registered, and I think even adoptions as well. Now, that comes from the fact that information gap has been there. DROPA 2015 mandates NERA to do so, but NERA needs a multi-sectoral approach, including implementing partners and citizens to contribute. And so, in this perspective, one of the strategies that partners like HEPS Uganda and other CSOs are doing is to ensure that we promote public awareness about the importance or benefits of civil registration and vital statistics. This has to be done right from education, health, gender, and other sectors. We have had people in the public sector and private, when they are registering their companies, one of the issues they find is identification. And who certifies that? it is NIRA. So as they run from URSB up and down, business processes are delayed. So it is just not about education, health, but also business, travel. All these things need information in a system. And so as a result, we are going to create coalitions, movements that are happy to spread the gospel or the message of benefits of accessing CRVS services early and urgently. And so we are even calling upon us who are here that please let this message be integrated in our programming. Then two, one of the issues that CRVS services have experienced in the country is inadequate funding. You've heard that 24 districts don't even have a branch office, but that's not all. Even staff need retooling. They need more. They need equipment. You've been to some of these service centers, maybe when you are renewing your ID, and they are telling you to keep turning your fingers, and you know the system is not working, and you are rubbing it either on some spirit or on the cloth, but the equipment has done its job and it needs a replacement. So, but when you look at the investment case of NIRA, it has not been adequately funded. And so as CSOs, part of our role is to create that movement, but also engage MDAs in budget advocacy processes to see that NIRA and other MDAs that are supporting the country in delivering CRV services get budgets that support them. One, to be able to expand these CRV services to every district, such that Ugandans at every mile can easily afford and access these services. Yes. Then two, agencies are not working in tandem. The issue is interoperability of this data. For example, weekly, Ministry of Health has MPDSR updates. But after a quarter, is NIRA aware that these are the number of women who have died last month, these are the number of children who have died, these are the number of men who have died, and these are the causes. So this part of budget advocacy is what is going to create systems that speak to each other to promote access to CVRs. Lastly, there is legal reform. Some of these things need a legal system that enables CRVS systems to work. So some of the things we are going to do is to do a legal landscaping and analysis to see how best can the interministerial technical working group work together and perhaps incorporate Ministry of Health with that vast data it has in the DHSI2, incorporated such that other agencies and departments can access that information. So all this is supposed to be done. It is in line with the UN, WHO, the African Charter on Children, Rights and Welfare, SDGs, our Constitution, Vision 2040, all these enabling legal and policy guidelines support all these services to be enjoyed by all Ugandans and non-citizens who are legally living in the country. And so, as a result, HEPS Uganda is part of this team to call upon you support various services, but also when we call upon you to engage stakeholders, please always come such that we see how best to take equity for health to another level. I thank you.
Colleagues, I think we have had a round of very detailed presentations and submissions, and thank you to the panelists. And again, if you're interested in the CRVS work that HEPS is leading on, Reach out to Robert before we depart so that you're registered into the civil society and not only civil society, okay, stakeholder platform that will be pushing for CRVS efforts at country level. Let's get through questions and then we proceed. Okay. Let me start from here and come through.
Thank you so much, presenters. I think my questions were comments will go directly to Mr. Kasumba. Mr. Kasumba, with the NIRA, I know you're doing a lot of work and you're doing good work for us to ensure that we are registered. But the challenge we are finding is that you're doing things retrospectively. You are, like for instance, I don't have a NIRA birth certificate. So if I come there, you want me to give you a birth certificate and be as accurate as though I was born today. And that's the challenge. So if I can't, if I haven't structured myself, if I have to tell you the truth about myself, how I was born and how I've progressed, I will not get that birth certificate. Trust me. I'm telling you this because I have an example. I have a brother who went to register for a national identity card. And he gave all the details of how he was born and how he has moved. He has never gotten that national identity card and he will never get it. Me, I have mine because I knew how to go about it. So what do you want us to do? Number one, you guys are employing people, young boys and young girls who do not know civics. Those who studied by my time during the primary school know what I mean by civics. They do not know what a sub-county is, but they will ask a sub-county. Some of them even call it a sub-country. And they are the ones entering data. They do not know what, they have no picture of what an LC1 or a zone or a ward is, but they will ask you what is the ward. Today, sub-counties have been chopped. If I go back where I came from, where I was born, which was a village, now it's almost becoming a county. Being subdivided, so where was I born? Which sub-county? Now, so my question is, how do we compile this? Then another thing again, before I go that, you have so many things, and you have so many sources of data that are not speaking together. For instance, if I come to you, to NIRA, I'm supposed to present a birth certificate from the hospital, a birth certificate from the sub-county or wherever it is. Then I also present myself. Then I have to speak. So the three must speak together. And many times they are not coordinated. Now, the other issue is, you know that we have different cultures. People are not given names at birth. Because some cultures have to do some functions for somebody to get a name. So that means the name that is written on that child's birth certificate in the hospital is not the name that they represent with at NIRA. But you want the names to be as accurate as you want it. Honestly, let's use data. For me, and again, I believe if somebody walked into your office who was not born, over 50% of us were not born in hospital, of Ugandans even as today. If somebody walked into your office and want a birth certificate of their child, the mother and the father have not been to school, have not registered anywhere, they won't get the birth certificate. But what is the credible source of information about my child? I think it is me. Because even the hospital information, I gave it to them. So what am I saying? I think if I present to your office, and you should tell it to your staff and your team, that the burden should be yours to ensure that I get my certificate. It shouldn't be my burden. My burden should be to present myself so that I get the certificate. You should do everything possible. Do whatever you want. Try to remind me, where were you born, which day, so that you remind you. Because I'm speaking this because I arrived from the healthcare system where I know that when a patient presents to me, it's now my burden to ensure that they feel well. It's no longer their burden. Whether they cannot talk, whether they cannot speak anything, I'll make sure they get the services that I should be able to. It becomes my burden to treat them, not their burden again to present, because they have done their role. So I think that's what we should be able to do. Otherwise, we have trouble in this country with so many registrations. I would have gone on and gone on and gone on because I have so many places where you could have gotten that. The other thing is that you have UBOS. Where do they keep their data? So there are so many things. Thank you.
Thank you. Those quite a number of observations. I already have the 3 hands, unless there is any other burning hand.
Thank you, Joanne. My question, I'll go directly to Mr. Kasumba, and well, one was preempted by the previous speaker, the one who was just asked. How does the authority handle challenges such as the late registrations or corrections of the vital records? I think that one he asked somehow in there. Then, are there any initiatives or programs that are aimed at increasing awareness and participation in the civil registration amongst the population? Then lastly, what efforts are being made to address the disparities in the registration coverage among the different demographic groups or regions? Thank you.
Thank you, Carol.
Yeah, thank you very much for the presentations you made. Actually, you caught my attention right from the first when you say that a child would be born and die and no one knows because, you know, they were not registered, their details were not captured. That is so important. But this question I'm going to ask, I just want any one of you to grab it. It's a very simple question. I want to find out, traditionally there was ways of identifying people before we came up with papers and English and everything. So there were ways of identifying people, maybe the village chief, the local village chief, traditional chief, or, you know, there were ways. We knew a woman who had a baby, and we knew the baby was named after the grandfather or the father who died or the brother who died at birth. And we knew this, and people knew. You know, a young person would say, yeah, I had a brother, my mother had a stillbirth, it was a boy, and things like that. So my question is, do you have any linkages with these traditional ways? Like, for example, in the rural areas, these people are still there. You know, the traditional birth attendants, you know, they still hold on to traditions. There are these structures. Do you have any links with these structures to help you in your work? Because your work is vital. It's very important. Your work is too important for it to be done in, you know, ivory towers. It has to be done on the ground too. Thank you.
The questions are very clear and majority are going to the NERA entity. Please, if you may take a few minutes to respond. Over to you.
Yeah, thank you so much, moderator. Thank you, members, for those wonderful questions. One thing we may have to admit as a country, we had challenges, especially on those first registrations of 2014. Majority of our registration officers were younger people who didn't take in the records correctly. But as a way of responding on the number of issues that have been raised, of course, as a country, we have undergone changes. These changes are not only in the law, that is the Registration of Persons Act, which actually calls for the compulsory registration of those vital events in this country. Maybe even before I can go into the details, I want to assure you, and that is why we are calling over your communities in your respective capacities, researchers, policymakers, doctors, and of course community workers, that let us as a country join in hands to ensure that we move together if we are to develop this country. In countries like Estonia, they are no longer carrying out census. They are depending on that foundation register. That is the National Civil Register, Civil Registration Register. I can also tell you that as I'm speaking now, over 83 ministries, departments, agencies, and private sectors are now connected to the National Identification Register through the third-party interface. I never wanted to go into those details. You cannot get a passport without being properly identified. The moment you give a wrong information, that means you are denying yourself a service somewhere, somehow. You cannot get a driving permit because they are all linked, all those are linked. Even your NSSF, even your pension, the Ministry of Public Service, everything. That is why we are calling you people. Why are you leaving us in isolation? We are at the end user. For us, we register the events that have already been verified by the respective ministries, including the security organization of this country. Because as you are aware, we are registering citizens when it comes to civil registration and non-citizens. When it comes to identification, we are registering citizens and alien citizens, alien people, those who are legally residents in the country. Then the refugees are registered under the refugee register, which is also interlinked with the National Identification Register. I don't want to go into the thematics, but also maybe what you may have to know is that as a country, of course, we are trying to make sure that most of the system, the DHIS2 and others are linked to the National Identification Register. But what you should know is that the DHIS2, also some of those management information system, they are looking at the data in aggregate form. For us, we are looking at you as an individual, right from your birth and your individual capacity. We cannot report that you have died, for example, without getting proper information from your next of kin, as provided for by law. That is why ours is a bit tricky. It is evidence-based. We are now going to produce a voters register. You are aware, that is why we are promoting, when we go into this mass registration, that every child who is 16, every person who is 16 years and above must have registered by November this year. Come June 1st, we are registering all Ugandans. So let me go back to the questions. The certificate. You are aware when it comes to vital events, there is what we call notification, registration, and certification. Notification, which constitutes almost 70% of that business process mapping, is actually handled by either Ministry of Health or Ministry of Local Government. Ministry of Local Government through the respective local governments. This is very fundamental when it comes to registration. For us, we just validate and register and provide the certificate accordingly. That is why we are calling upon Ugandans. We are calling upon the ministry. We are calling upon researchers that you come to our rescues. The administrative units are changing almost on a daily basis. As I'm speaking, as we started, we are having only 117 registration centers, which are also very far. Somebody was talking about teenage pregnancy. It is a problem in all islands. At one time I was in Kavuma, and these children were over 200 children mothers who didn't have their national IDs, and they were wondering, how are we going to register our children without the national IDs? So we have to provide a quick solution. These people have over 50 islands. We have to move on boats at night to ensure that the children are registered. This is the same case with the Mokono, with Kalangala. In terms of awareness creation, of course, you're aware we have the community, we call it communication strategy, which was properly funded by some of our development partners. It is working and it has elaborate and comprehensive way on how we are going to handle almost all this. We have the Uganda Civil Registration and Vital Statistics Strategy, which also enumerates a number of things. Then the disparity of registration. This is something which is still a problem. Because even if you say you have a registration center at the district, some districts, when I was in Iriantonde recently, they say the farthest health center is 70 kilometers away.
As you conclude, please. As you conclude.
That what?
I'm saying as you conclude.
Okay. Okay. Then there are a lot of, I think I've answered. There is a lot of the different community leaders in the registration process. As I've told you earlier, of course, I told you 80% of deaths happens, 64% of deaths happen in community, 80% of birth happens in health facilities. The other percentages, the other balance is actually handled by community in terms of our leaders, LSU1, the religious leaders, faith-based leaders, and the like. I think we shall go into those details. I don't know whether I've ably handled. Though, of course, this one takes into account the traditional bus attendants and the others. I think I've tried to talk to each and everything. Thank you.
Okay, thank you very much. Most of the questions were direct to NERA, so I'm going to maintain that the response that has been provided is adequate. The rest of the team, I know there are other engagements that are going to be civil society led, so please, I encourage each one of you to come on board by registering with HEPS Uganda if you have interest in this particular component of health. Thank you once again. Let's give another hand of applause to our panelists.